weight loss, or more specifically, a very hot topic nowadays, weight loss medication. What I mean by that are those big names you've probably heard of: Ozempic, Wegovy, Mounjaro, and there's a few more. What these are a new class of medications called GLP-1s, or glucagon-like peptide 1 medications. Now, they do work in very interesting and very cool ways. So overall, what they do are appetite suppressants. This is a very basic and simplified way of explaining what they do. But GLP-1s, they modify that satiety mechanism in your body. This leads to you getting full a lot easier when you do eat. This leads to you not really feeling hungry when you're not eating, and it sometimes causes some bloating, so you do feel a bit more full up. You don't really feel like eating most of the time. Anyway, if you put all of this together, this means you consume a lot less calories, and when that happens, you lose weight. And the benefits of losing weight are immense. Not to mention improved insulin sensitivity, lower risk of heart problems, bone and joint disorders, and a whole host of other problems. In fact, when it comes to what are the most beneficial things someone can do for their body, right underneath stopping smoking cigarettes is weight loss if you're overweight or obese. That's probably the most powerful change that you can make in your life for a better health. So what these medications do, let's say Ozempic and Wegovy, this is the medication called semaglutide, and there's another medication called Mounjaro, very popular as well. That's a medication called tirzepatide. Work very similarly, slightly different. Let's have a look at semaglutide first. So as I mentioned before, it's a GLP-1. It targets the glucagon-like peptide 1 receptor. What this leads to increased feeling of satiety, as well as it also slows down, reduces the movement of food through your gastrointestinal tract. So food takes a bit longer to go through, so you feel bloated, you feel full up for a lot longer as well. Originally, these medications were actually designed for people with diabetes. So Ozempic is one of the first ones designed for people with diabetes. And actually, the people with diabetes that were having this medication, we all noticed that the side effect was that they were all losing weight as well. And when it comes to diabetes, weight loss is one of the main treatments for diabetes. So once we noticed this, we were thinking, okay, this medication seems to be causing weight loss. Does it also cause weight loss in people who do not have diabetes? Cue some further years of studying and research, and it was proven that even without suffering from diabetes, taking these medications will cause or has a very high chance of causing weight loss in that individual, purely because of the appetite and satiety effects that it has. I mean, there's a reason why they're so famous, because it's one of the first sets of medications that actually work and achieve a significant amount of weight loss for the majority of people that take them. And it does a good job of tackling the root cause, aka excess calorie consumption, of obesity and being overweight. Now, it's not completely smooth sailing, because there are some side effects, there are some problems that can occur. There are some common, less dangerous side effects, and there are some more dangerous side effects. Let's go for some of the less dangerous first. So as I mentioned earlier, where it slows down the movement of food and it has an effect on the appetite and satiety mechanisms, this can lead to some of the side effects. So it can cause feelings of being bloated, feelings of fullness, which is positive or negative, depending on the type of person that you are. Because of the slow movement, food can sit inside of your stomach for longer. This can lead to lots of burping and actually reflux, which is that feeling of acid coming up your stomach. It can lead to a lot of bowel problems, things like diarrhea, constipation, cramping in your bowels as well. This can all be a side effect of the medication. It does have an increased risk of causing gallstones. Gallstones are when you get small stones inside of your gallbladder. Your gallbladder is an organ sitting just underneath your liver and it's responsible for storing bile. Now, gallstones themselves are usually not too bad, but what they can do is that stone can leave the gallbladder and get lodged or stuck inside the tunnel leading out of the gallbladder, and that can cause a blockage or an obstruction in that system, can make you quite unwell. Sometimes the stones themselves can actually cause inflammation of the gallbladder, and that's called cholecystitis or gallbladder inflammation. That can make you quite unwell. Now, the worst thing that can happen, or the most dangerous side effect, is actually the risk of pancreatitis. So the pancreas is another organ also near your liver, which does a lot of things, but it's very important for producing hormones. And in this case, what we are interested in is it produces insulin. The pancreas can become inflamed as a result of taking this medication, so it becomes damaged. If that happens, usually the symptoms are a lot of vomiting, a lot of nausea, and in the worst cases can actually cause death if it's not treated in time. Thankfully, the chance of that happening is very, very low, and it's extremely rare. Remember, it is a medication. It does need to be prescribed for you, so don't just take it willy-nilly. Make sure you do speak to a medical professional like myself or your own medical professional who can go through the risks and complications with you, can assess if you're suitable for this medication in order to help you lose weight. So who is this medication for? So when this medication is being used for the purpose of weight loss, the ideal patients are people who are very overweight. In the NHS, we do have criteria. I think the criteria for prescription is a BMI of above 40 with no other cardiovascular morbidity comorbidities. It doesn't mean that you have to have no, it just means it's not part of the criteria. So BMI above 40 allows you to take the medication, or it can be prescribed for you, or a BMI of 37 or above with at least one cardiovascular comorbidity, like high blood pressure, like high cholesterol, like a risk of heart disease. How easy is it to take? Well, it's actually very easy to take. It is an injection. It's called a subcutaneous injection, so it's just under the surface of the skin into the layer of fat under your skin. It's only a few millimeters deep, and it's taken once a week. In fact, it comes in these auto-injector pens, which are actually designed for people with diabetes, but it makes it very easy to inject this medicine yourself. And results typically take a few months to appear. So in terms of results, we are looking around about the 6-month mark, and the majority of patients are going to be losing around about 27 to 28% of their total body weight. So monitoring. Now, it used to be thought that semaglutide and Mounjaro does have issues with the thyroid. And actually, there was a risk of thyroid cancer. That it did used to be a risk. If you go on the BNF website now, which is the British National Formulary, that risk is no longer there. So actually, it's a lot safer than we used to think it was. However, it can still cause some thyroid problems in people who are susceptible or have thyroid issues already. So in terms of monitoring, I would say to get some blood tests regularly by checking the health of your thyroid, as well as a full blood count, as well as looking for any signs of inflammation and liver function tests. This is just to keep an overall view of your health as you go through. If you're taking this medication, it's a very good idea to let your health provider, so your GP or your personal physician, know that you are taking this medication so that they can be aware of the possible problems that can occur, and they can advise you the best because they know you personally. If you'd like to know more and find out if this is suitable for you, then have a chat with myself where I can advise you if this is the right method and treatment for you. And you can do this by booking a free consultation online on our website or DM us here.